I'm so glad you came into my office. I heard that you were having a few tingling sensations in your legs and your head was not feeling right.
My face, yes. And I'm waking up at night with severe leg cramps in my calf muscles.
I'm
They
so
just
sorry.
contract. They wake me up at night and then I have to get out of the bed and walk it off for a couple of minutes, but the pain is very severe.
Well, we'll definitely get you checked out. I'm so sorry to hear about that. We'll do an analysis of your legs and your muscles. What's going on with your face?
During the day, I start having some tingling sensations. It feels like an ant is just crawling up my face a little bit on both sides. So I feel like something is on my face even though there's nothing there.
Yes, for sure. We'll definitely do a full analysis of your face, including a sensation test to make sure that you're feeling the correct sensation. And if we are having any troubles, we might need to schedule a specialist appointment. But I'll do everything I possibly can today to help you figure out your sensations and feel better.
And I also believe that I could benefit from a little bit of a massage in my calf muscles.
Yes, definitely. I'll use my gua sha tool and some oils. It will really help. I know it will.
That'd be wonderful.
Let's get started.
Okay.
I'm going to put on my gloves. And I just had a few questions. Did you hit your face or your head at all?
No, I didn't have any accidents or any injuries. I've changed my creams recently. I'm not using the same cream that I used to use, so maybe that could have contributed, but I very much doubt it because I've used other products in the past too, and this has never happened to me. And that's the only difference, the only change that I've made recently. Other than that, no injuries, nothing that could have explained what's going on.
Let me get started with a light palpation of your head.
Okay.
Just looking for any masses or abnormalities on the scalp. I'm not feeling any obvious lumps or bumps that might be of concern. I'm going to take a look at your skin coloration on both of the ears. Do you ever have any ringing of the ears?
No, I don't suffer from tinnitus, no.
I'm going to start off by looking at your skin, starting off with the T-zone here. I do see that your skin is very well hydrated, which could mean that the cream you are using now is best for your skin. I do see that your eyebrows are well perfused and there's no balding going on or anything like that on the eyebrows, and no missing eyelashes. The skin is warm to touch on both sides. The lips are pink and moist. The neck is warm to touch. Just going to do a very light palpation on the face. Can you feel this?
Yes.
And this?
Yes.
Let me know if this is uncomfortable for whatever reason. Open your mouth slightly. Any jaw pain there?
No. Quite good.
Very good. Going to be raising your arm just slightly so that I can examine your skin and do an analysis of possible melanoma patches, which would look like moles. And as I'm looking at your skin, I'm seeing just a little bit of a bruise right there. Do you remember what caused that?
I have no idea. I bruise very easily.
Is this black thing here from a marker?
Yes.
Spread your fingers for me. Your fingers are healthy. There's no spotting on the fingers that might be raising awareness to some sort of infection or abnormality in the lungs or the kidney. Doesn't look like we need to worry about anything on the inside of the hand. Can you wiggle your fingers? Very good.
Have you raised a hand?
And I will have you raise your arm all the way up. Wiggle your fingers and then all the way back down. Any pain?
No.
Just going to do a light palpation of the arms. I'm going to palpate. Any pain?
No.
I'm going to raise this arm just slightly here. I'm going to use my light to take a look at the skin. You have a little bit of redness here. Is it itchy?
Yes. My skin is very sensitive, so whenever I rub off any materials on it, it kind of gets a little irritated.
Okay. Let's take a look at that again after the exam to make sure it hasn't gotten worse. And I'm just bringing my light down the forearm. I do see one mole there. Have you had it checked out?
Yes, every 6 months or so. I am at high risk for melanoma because of all the moles that I have. So I keep a close eye on them.
That's very good. I'm glad that you do that.
I had about 8 of them extracted and biopsied.
Wow. Can you spread your fingers for me? I'm glad that you take good care of your skin and keep on top of that. It's very important, especially in today's day and age. Let me have a look at your palms. I don't see any moles on the fingertips or the palm of your hand. Just going to keep an eye on this throughout the examination.
Okay, sounds good.
I'm going to palpate the arm just slightly. And bring this arm all the way up if you can. Wiggle the fingers and bring it back. Do you have any tingling sensation there?
A little bit in the tip of my fingers, yes, and I kind of feel the same tingling at the top of my scalp.
Interesting. Okay.
It happens when I'm being touched very intensely like that.
You might have a blood flow restriction, which is caused by potential high blood pressure or high cholesterol. I will have you your heart checked with my specialist in the next couple of weeks to get that checked out, okay?
Sounds good.
You can never be too careful.
Okay.
I'm going to use my reflex hammer here to tap on the bony prominences of your face, going by your sinuses, and then all the way up, and then all the way down to your jaw and chin. Can you feel this?
Yes.
And down your nose?
Definitely, yes.
And by your eyebrow bone here?
Yes.
Any uncomfortable feelings?
No, it's quite good actually.
Any chest heaviness as I'm palpating your chest?
I usually have a lot of chest heaviness. Right now I don't.
Any tingly feelings down your arm
No.
as I palpate?
No new tingly feelings now.
Let's do a thorough sensation test, as I am just a little bit worried about your sensation ability. We'll start off with a very simple, sharp or dull. This would be a very dull, soft feeling.
Yes, I can feel it.
And this is more so a sharp.
Yes, I can feel that too. Dull. Sharp. Sharp. Dull. 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 Sharp.
Now that we've created a little bit of a different sensation on your face, I'm going to use my reflex hammer one more time, and I want you to tell me when and where you feel it.
The top of my forehead in the middle. My nose. My forehead again. My chin. My right sinus. My left maxillary sinus. My chest. Across my clavicles.
You're doing a lovely job so far. I have this device and it's a little bit cold. Okay. I'm going to run it across your face in various ways, and then I'm going to stop. Say yes when you don't feel it anymore.
Yes. 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 Yes.
Once again, excellent performance. I have a sharp sensation here, and just tell me when you feel it.
I feel it. I feel it. I feel it. I feel it. I feel it.
I want you to keep your eyes closed, and I'm going to spray your face. Say yes when you feel it.
Yes. 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 Yes.
It looks like you can definitely feel everything correctly. Let me just pat your face dry.
Okay.
Now we're doing a temperature test of warm and cold.
Okay. Warm, cold, warm, cold, warm, cold, warm, cold. Warm, I believe. Cold, 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 warm, cold, cold, warm, cold.
I do need to measure your face. For proximity and balance. Measuring your nose. And your ear. Do you wear contacts or glasses?
Yes, I have my right eye is at -9 and my left eye is at -6. So I'm quite blind to the distance.
Wow. So right now you're wearing contacts.
Yes,
You should be able to see things such as my fingers.
correct.
Very good. I'll have you look at my fingers. Going to come in quite close and take a look at your optic nerve. Just keep looking over there. Okay, I'm having a very close look inside your eye. I'm noting there's no popped blood vessels and no extra tears of any kind. I'll have you look up. The optic nerve is intact and healthy looking, and it does not look like you should be having any troubles with it as far as things like floaters go.
I never get floaters, no.
Good.
I do get dry eyes sometimes, but that's because I'm staring in the computer way too much.
Makes sense. Okay. I'm going to have you look over here, and I'm going to come over to this side and come quite close. I'm going to have you just relax as I look inside your eye. I see the optic nerve is intact, and I don't see any popped blood vessels. The optic nerve does look good as well. It is attached to the wall of your eye. Can I have you look up, please? Okay. No abnormal discharge. Your eyelashes are beautiful, healthy, and long. I'll let you blink that out. Are you in any pain currently with your eyes?
No, no pain.
Okay. I'm just going to lightly palpate the eyes here. Any discomfort?
No.
I'm here, I'm going to take a look inside your ear, looking at your tympanic membrane. Do you have any pain in your ears right now?
No.
As I lift up, back and down, any discomfort?
No.
I'm going to pull it back so that I can have a look inside. Your tympanic membrane is very, very clear, probably more visible than I've ever seen anyone's. There's no earwax at all, and the tympanic membrane is pearl gray. Have you ever had any problems hearing?
No, I hear quite well.
I'm going to do a hearing test on this side, so I'll have you close your eyes.
Okay.
I want you to guess this sound.
I believe it's a scissors.
Yes, it is. Tell me how many times you hear the sound.
3 times.
And now?
2. 4.
Let's move on to your left ear. I'm going to focus on this ear. I'll have you just move your face. So I am going to pull this ear up, back, down. Any discomfort?
No pain, no.
All right. I'm going to pull back as I look into the ear, looking at the tympanic membrane, which I see very, very clearly. You have quite short ear canals, which is so interesting to me. I've never seen this before. And you have not one drop of earwax. Do you take really good care of the earwax?
Yes, I do, on a regular basis.
I can definitely tell. You must have the best hearing ever.
Yeah, no complaints with the hearing.
Let me do a quick hearing test on this side.
Okay.
Once again, let me know, what do you hear?
Scissors sound.
And count.
3 times. 2 times. 4 times.
Very good. How is your sense of smell and taste?
I have almost completely lost my sense of smell. I can't smell anything.
Wow.
Yes, I have allergic rhinitis ever since I was maybe in 5th or 6th grade. And my nasal pathways are just very dull.
Wow. Let me
I can't
take a
smell
look.
anything.
Wow. Not even perfume or candles?
If it's very strong, then yes, I can. But if it's not strong, then not one thing. Yeah.
Might be a good thing in some cases, right? I'm going to take a really quick look inside. I'll have you look up. Okay. Nasal cavity is clear on both sides. Okay, there's no obstruction. I'm going to have you, hopefully this is strong enough, but I'll have you smell this.
I believe it smells like a rose, but I'm not quite sure.
That
Maybe a
is
rose.
true, yes. The color of this device gives it away. But you did a very good job.
I didn't even notice the color.
Have you ever had tonsillitis?
No.
Okay. I want to do a really quick mouth swab for any possible infection.
Okay.
Start off by taking a look inside your throat. This is a tongue suppressant. And I'll just have you say, oh. You don't have swollen tonsils. Your teeth look very good. On both sides, you have beautiful teeth. Have you ever had fillings?
A few of them, yeah.
Okay.
I have to go to the dentist every 2 months for a cleaning. I'm just addicted to getting my teeth cleaned.
Wow.
Every 2 months I have to get them cleaned.
That's wonderful. You're the
Yeah.
opposite of someone afraid of the dentist.
A good addiction to have.
Definitely.
Dentist addiction.
Your teeth look wonderful, by the way. They are super, super clean.
Thank you.
Let me do that swab really quick.
Okay.
It'll be one on each side.
Each cheek.
Yes.
Okay.
Send that into the lab for testing.
Okay.
In the meantime, I am finished up with the upper body examination. We'll move down to that massage on your legs and we'll get you feeling much better by the end of this. Are you comfortable?
Yes.
Wonderful. Going to use my light to do a very simple skin inspection. And I'm finding just a few light freckles on this leg here. And checking the heel and the toes for any signs of plantar warts or abscesses. I'm looking at the other leg and I do see that your calves are here. They look very good. It looks like you do a lot of exercise. Are you working out?
Yes, I'm a runner.
Oh, very good. I see just a little bit of skin coming off of the bottom of the foot, but it doesn't look concerning. Let me go ahead and measure your calves. I do want to be sure to notate if one is bigger or larger than the other. So this is about 5.5 inches. And the same on this side. The calves are also matching each other. Moving down to the sole of the foot, measuring the heel. And the length of the foot here. Is your shoe size 7.5?
Yes, that's exact.
That is what your feet are both measuring at, including the big toe here. The width of the foot. Going to bring your foot up. Can you wiggle your toes? Very good. I'm going to measure them. Any discomfort there?
No.
Just relax into my hand. Any pain?
No.
I am going to check for any discoloration on the toes. No discoloration in the toes. We're going to do sharp or dull. This is dull. And this will be sharp.
I can tell the difference as dull, sharp, dull, 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 sharp, dull, dull, dull.
I'm going to use a sharp tool on you. Just say yes when you feel it.
Yes. 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 Yes.
Say yes when you feel the next sensation.
Yes. I feel it. Yes. 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 Yes.
I'm going to use my reflex hammer on your calves, and I do want you to tell me if you feel them spazzing from this, okay?
Okay.
Any spasm reaction to that?
No.
Lovely. Going to use my massage oil to give you that massage I promised you. Are you okay with me using some oil?
Yes.
How does that feel?
Feels great. that's where I usually have the pain right there.
You're definitely quite knotted here. You might need to go in for regular massages. Very tight right here for sure. And it could be that you might carry your stress in your calves, because most women carry their stress in their shoulders, but you could be carrying it in your calves, honestly. This oil is just soaking up into your skin. It's completely dry now, which is amazing. That should really help with the pain. How are you feeling?
It feels really good.
You can come up now.
Thank you so much, Dr. Kath. That was so relaxing.
Yes, I put all of my energy into that lovely calf massage. I could feel those knots coming loose. You should not have any more spasms. As far as your sensations go, you passed your sensation test. You didn't have any of them incorrect, so I don't think that you need to worry about whether or not you are feeling something. It might be that maybe you did actually have something crawling on you a few times.
Could be.
So
yes.
you might want to wash your bed. Maybe you have bed bugs. But I didn't see any obvious signs either. So I think maybe just keep an eye out for your detergent. Maybe use the gentle kind. It could be that maybe you have an allergy to your pillowcase.
That's actually a very good point. I don't use hypoallergenic detergent, and I should, because my skin is very sensitive. So I'm gonna go ahead and do that.
Tide has a very good free and gentle white container.
Yes.
It's wonderful. That's all I use.
Very good suggestion. I'm going to do that. Thank you.
Oh, you're welcome. Have a lovely rest of your evening.